So the next thing I'm gonna show you today is how to put eye ointment in a horse's eye. So horses have these large eyeballs that kind of stick out the side of their face. So they're really prone to getting corneal ulcers, or also known as scratches. And today I'm just putting a neomycin ointment without any type of steroid in it. You always want to make sure you stain an eye and use ointment with a steroid in it directed by a veterinarian. So you're just going to pinch her eye open and then put a 3/4 strip into the eye. And they'll blink it and it'll grab the strip in. Now these tubes are metal, so you'll see the end kind of tend to squeeze out a little bit, and that's okay. But what you don't want to do is touch the end of that to your horse's eye, because then it contaminates it. The next way, I'm going to show you a slightly easier version to give eye meds, especially if you have a horse that is a little more difficult to give eye meds than Pistol here. She's wonderful. But if you have a horse that's not used to getting eye meds, or you have to give a lot of them, here's a slightly easier way. So I'm going to use a tuberculin syringe. I'm going to take the needle off of it. I'm going to pull the plunger out, hold the plunger in a sterile manner. I'm going to unscrew my cap here on my ointment. I'm going to sit that open end up, and then I'm going to squeeze about 0.2 into the end of this syringe here. Put my cap back on, and then you're going to put your plunger back in the end of your syringe. And then the end of this syringe is nice and blunt, and a horse has what's called a third eyelid. And this lives at the front of their eye here, and you'll be able to see it in just a second. So that protects their eye. So I'm not scratching her eye as long as you go at the front of the eye. So you're going to pull the bottom eyelid down and put the plunger in the front of the eye like this. And if a horse has a painful eye, they will squint like this. And then you're going to push in the meds just like this. And then if they hold their eye closed just for a second, so it kind of moves the medication over the eye, because we did put it just at the front. And so that third eyelid lives, I can get her to open her eye, right in the front of their eye over here. So as long as the medication's administered there, then it's safe to do it that way.